All right, welcome to an episode of the Front Row Podcast. I'm Coach Mark Gottfried. I've got an amazing, wonderful, this is going to be a lot of fun today for both of us, but I've got an amazing guest, Dr. David Fajgenbaum, and even on the ride over, full disclosure to everybody, David will soon be my brother-in-law, so I'm excited about that as well. I will marry his sister soon, but we were talking. And, you know, the question came up, do most people, or do you prefer, physician, immunologist, scientist, kind of where does that fall? And then once you answer that, I'm going to give the audience a little bit more about you, but where does that fall for you?
Sure, I refer to myself as a physician scientist, but anything you just said would be right.
Former college football player.
That's right.
Brother-in-law. But, David Fajgenbaum, he's got an amazing story really about his life, and he's involved in some amazing work that, we all do interesting and fun and amazing things in our lives. But I've told many people, Dave, what you do, and, you're saving lives, and not just kind of saving, like actually really truthfully saving lives, including your own. And David has done an amazing job. I'll tell you a little bit about him, and then we'll try to dive in. But he's written an amazing book called Chasing My Cure. And this is a phenomenal book that has also led to Dave signing the rights to a movie deal coming up with Wendy Finerman, who was the producer of Forrest Gump. And so we're really excited about that. But, just real quickly, I want you to kind of tell the story about your own life. Grew up in Raleigh, North Carolina, great high school player, recruited to play college football, college quarterback at Georgetown. And then from there, David, kind of take us through your journey just a little bit and kind of how you got from there kind of to where you kind of are now.
Sure. So, just like you, I dreamed of playing college sports. For me, I wanted to be a college quarterback somewhere, and that's all I could think about as a kid, and had the opportunity to go to Georgetown. We're not known for our football, but I did achieve my dream technically of playing Division I quarterback, though we certainly are, we're not Alabama. But so, I got there and I was so excited to be on campus and to have achieved this dream. And then my life turned upside down, Mark, because just 2 weeks after I got to Georgetown my freshman year, my mom was diagnosed with cancer. And so all of a sudden I went from, this, fired up, about to start my college football career, football player to being, the son of someone who's got cancer and saying, you know what? As long as I'm on this planet, I want to put every moment I've got left to help and to find treatments for people like my mom. And for me, it was like a switch just flipped. And it was like, I'm all in on going into medicine. I still played at Georgetown all 4 years, but I wasn't mentally, locked in the way that, you got to be a great college athlete. So decided I wanted to dedicate my life to searching for cures, and went to Oxford for grad school, went to Penn for medical school. And in my third year of med school, I was sort of at the pinnacle. I mean, had just delivered my first baby into the world when I was on the OBGYN rotation. And just a few weeks later, I just started feeling horrible. I felt more tired than I'd ever felt before. Noticed these enlarged lymph nodes in my neck. I was having night sweats. I just noticing fluid around my ankles. It was just crazy. And over the course of just a few weeks, I went from those early symptoms to walking down the hall in the hospital that I was working at to the emergency department, and they ran blood tests. My doctor came in the room and said, David, your liver, your kidneys, your bone marrow, your heart, and your lungs are shutting down. We have to hospitalize you right away. I mean, I had just been taking care of patients, but I knew something was wrong. And so I got transferred to the ICU. I gained 70 pounds of fluid because my liver and my kidneys weren't working. I had a retinal hemorrhage that made me temporarily blind in my left eye. Was basically in and out of consciousness for weeks with no diagnosis. And as you know, my sister Gina, who you know obviously very well, it's your new fiance, she and my other sister Lisa and my dad, they never left my side. I mean, they were with me through everything. But at one point, I was so sick that we said goodbye to one another. And so it was some really low times. I had my last rites read to me. And that's all without even having a diagnosis.
So here you are, you're a guy that's played college football. I've seen pictures. I didn't know you back then, but, massively in shape, great body, strong, fit, athletic. go to Oxford, and you're at Penn, and boom, this hits you.
Out of nowhere.
And it's interesting, over the last few years, I've gotten to know you very well, and I've heard you speak a number of times, but I've never really heard you talk about, and I'm often wondering, because I think human nature, there's a part of us that says, why me?
Yeah.
Okay, here I am, I'm young, I'm vibrant, I'm in shape. You've got this beautiful girl that you were dating.
Yeah.
That's a whole nother story off and on, and you ended up marrying Caitlin, who's beautiful and wonderful.
That's right.
But was there ever a point where you're by yourself in the hospital, doctors are saying, really, there's nothing else we can do?
Yep.
Where you just kind of, it's the woe is me, which I think is human nature. There's nothing wrong with that you just say, man,
Yeah, for me, it was, I guess, a little bit less why me, and part of it is because, watching my mom's diagnosis with cancer, I mean, she was a saint, Mark. I mean, I know you hear me and Gina talk about her a lot, but she was just like the best human ever, and watching her get sick and then pass, for me, it was sort of like, I guess if my mom, who was like perfect in every way, could get sick, sort of anyone could. So it was less why me, and also in medical school, you encounter a lot of people who get sick, and there's never a rhyme or a reason, right? And so it was less why me and more the low point that I think you were sort of imagining was me being like, I can't do this anymore. I mean, I sort of hit my last leg, and I was just like, I got to give up. I'm going to give up. And it was because I had so much pain all over my body because all the fluid that was everywhere. And so, I remember very vividly a point where the pain, every breath I took was like basically getting stabbed in my lungs. And when the pain's that bad, you basically just slow down your breathing and then you pass. I mean, it's that bad. And I remember being in the position where I wanted to just give up. And I remember hearing Gina and Lisa saying, just breathe, Dave, just keep breathing. And they said it at the exact time I needed to hear it. I mean, I was literally there, and I said, all right, I'm going to keep, it hurts with everything. It's the most painful thing in the world to take a breath, but I'm going to keep doing it. And, I never knew in that moment that 13 years later, you and me are going to be sitting here on a podcast talking. I thought I was going to keep breathing for another day, right? Got to fight for one more day, but here we are 13 years later.
How many times, Dave, do you think, and you know this, or not that you think, but do you know that you're at that point, doctors have said, okay, there's really nothing more we can do.
Yep.
But then you improve, you get better, but then you've had some relapses where you go back. And so how many of those where it's like, and again, so, I kind of relate everything to sports, as an old coach. Sometimes even when you're down in a game, you fight your way back and you climb over the hill. And then all of a sudden you're down 20 again, and then we can climb back. And there's only so many times, you can sometimes do that before you just say, you know what, I can't get over the mountain. I just can't get over the top. And so how many times for you were there those moments where you kind of were like, man, I'm exhausted. And I've fought it, I've gotten better, but now I'm backwards again.
Yep. Yeah, so for me, there have been 5 times over the course of a 3-year period where I was on the brink. Where the doctor said this is it, and for the last 4 of them, each of them had been after I'd gotten better at some point. And so to your point, there was so much frustration. But I think this also gets back to the sports analogy you mentioned, is that the only reason I'm here is because during those tough times, I had Caitlin, I had my dad, I had my sisters by my side, and they were giving me a vision for the future. It's like, I got to keep fighting for them, because maybe one day I can get married to Caitlin, and maybe we can have a family one day, and maybe I can keep developing treatments and help people like my mom. And so it was sort of like, when you think about in sports analogies, the moment you've lost hope, the moment you're like, we can't beat these guys, you're done. Yeah. But while you're fighting back, if you're like, there's a chance, we might be down, 42, but it might be the 4th quarter, but maybe we got a chance. And I think my family kept giving me that feeling that there's a chance, and so it just helped me keep fighting.
You mentioned your father, who I've got to know, and I really admire, but your dad was an orthopedic surgeon in Raleigh, North Carolina, and we never overlapped. He spent a lot of time with the football team on the sidelines with NC State football. Yep. I became the basketball coach at NC State, but he had just retired, so we never really had that opportunity to work together. But I've heard you mention many times about even your dad as well, being there for you and sitting there beside the bed and just kind of, so many nights, not leaving your side. And Talk about that a little bit, and how much that meant to have your father, and then you had lost your mother.
Yep.
So now here's your dad, and he was there. It sounds like to me that he really was there.
He was. He did not leave my side, and it meant the world. I mean, it really meant everything. I was so sick because all of my organs were shut down. I couldn't think straight at all. I mean, I didn't know what was going on. I was so confused, and frankly, the doctors didn't know what was going on for a long time either. And so having my dad there, knowing that he was thinking about what was going on, he was asking the right questions, that gave me some real peace. And actually, it just reminds me. So I spent almost 6 months hospitalized with this thing, and it was horrible over that period of time. But right as I started to turn the corner, I got a bunch of chemotherapy. It kicked in. It saved my life. But so the night before I'm about to be discharged from the hospital, my nurse comes in the room and says, "David, you must be so excited. You've been hospitalized. You're getting out tomorrow." I said, "Yeah, I've been in the hospital for 6 months. I cannot wait to get out." My dad goes, "What is this? I've been in the hospital. We've been in the hospital." And my dad. And he's like, "What is it?" So, and the truth is, he was right. He had literally been sleeping in the hospital on those pull-out couches, every night for 6 months. And he was by my side the whole time.
That's amazing. So when the doctors, how quickly after you became ill were you told, or did you hear the words Castleman's disease? Because I've never heard of Castleman's disease until I met you. So you're there, you're struggling, you're in the hospital, you're fighting, and now you're introduced to this thing called Castleman's. Were you aware of what that was prior, or were you not?
I wasn't. And it was 11 weeks since I'd already finished 3 years of medical school, and I still had never heard of the thing before. I mean, that's how rare it is, right? And well, the reality is there's about 5,000 patients diagnosed a year, so it's actually close to as common as ALS, but there's far less awareness. And there's a lot of these rare diseases that just haven't gotten any awareness. So Castleman was one of them. But I'd never heard of it. And 11 weeks in, I finally got the diagnosis. And we were like so excited to have a diagnosis. Like, yeah, we got an answer. Like, we're gonna beat this thing, And then, of course, we started looking online to understand more about this thing. And we're like, oh, shit. We got an answer, but like, it's not the answer we wanted.
Right. This is not good.
And it was because we had never heard of it before. They were like, sounds great. It's not lymphoma, but oh, shit. So we got the diagnosis, started trying to figure out what to do for treatment. And we just really quickly learned that there was very, very little in terms of options.
Prior to you learning that, and okay, here now we know what it is. At that time, the survival rate for those that had come down with Castleman's disease would have been
really bad.
Really bad.
So I read a Wikipedia page right around the time of the diagnosis, and it was old data. It was about 10 years old, but it said on this Wikipedia page that it was something like 80% of patients die within 3 years of diagnosis. And I'm 25 years old. And I knew it was a bad disease because it had been kicking my ass for 11 weeks. I knew whatever I was fighting was bad, but like 80% dying within just a few years. I'm 25 years old. I want to develop these cures and remember my mom. I want to get married. I want to have a family. So it sort of hit me right between the eyes. Thankfully, those statistics have improved since then. And of course, over the last 10 years with our work, we've really, really improved those statistics. But man, that was frightening.
I'm going to jump ahead, and then we can jump back, but because it's on my mind. And I went to a gala with you in Philadelphia and for Castleman's, and I remember, I can't remember how old the young girl, maybe she was 12 or 13, but some girl that you had helped. And, I can imagine their family, and I don't know how old she exactly was. She was probably very young, but when you learn that, hey, I've got Castleman's, it's like, obviously your sister Gina, my fiance, lost her spouse to ALS.
That's right.
And sometimes when you hear that, you're hearing a death sentence.
Yep.
As much as you want to believe that, hey, I can beat this, the truth of the matter is probably not.
Yep.
And but it was amazing at the gala to watch this young girl and her family. And I'm sure you have a lot of stories so far where there have been, whether it's young people or middle age or older, where they have felt there's nothing left for us to try and it's over, yet because of your work, and I know I'm jumping way ahead here, but that's got to be just an amazing, thing to be a part of. Like, we win I was coaching. We win a basketball game, I feel all excited,
Yeah.
But the reality is, it's a basketball game. Now here you are. Your wins are different. It's a different win than winning a football game. And so talk to me about that a little bit and what that's meant to you to watch some of these people. And I know I jumped way ahead, but help me there.
It's meant everything. I mean, Mark, I can't put into words. And this past Thursday, we had a Castleman disease patient in Philadelphia. She's 17 years old, and she spent a year in the hospital from the time she was 12 till 13 on chemotherapy nearly the entire year. Even chemotherapy couldn't get this damn disease under control. And at the last minute, her doctor had been calling me, David, are there anything we can try? And at the last minute, doctor called me at like 9 p.m. one night and was like, this is it for this girl, Kyla. You got anything for me? And I said, well, 2 weeks ago in the lab, we thought this drug did something that might be relevant for Kyla. I mean, why don't you give it a try? It's never been used in humans for this disease. It's approved for a form of blood cancer. It's never been used for Castleman's. But like, if you're telling me this is it, see if you can give it a try, right? And so, and she gave it a try, and Kyla sitting down next to me this past Thursday with her family around her, and we are talking about she's going to go to nursing school, and everything's telling us that she could live a full life on this drug. And it's like, I mean, I cannot put into words what that's like, Mark. I mean, I'm thinking about that phone call, and it's like, and of course the work had to be done to figure out that drug, but then the moment where it's like, what's the drug that you're going to say? And thankfully we picked something that could save her life. And now that drug, actually, we give to a lot of other Castleman's patients, and we just got a grant to study it and even more.
Yeah, it's amazing. So if anybody that's listening has a chance to read Dave's book called Chasing My Cure, one thing that's very interesting and probably unique, well, it's unique to me. I've never heard of anybody do anything like this until you. But so you're there in the hospital. You now know you have Castleman's. You're kind of in and out, you're getting better, you've gotten worse, you've kind of gone back and forth. But at some point, you decide, and help me if I screw this up, because I might, but basically, I'm going to find a cure for my own fatal disease that I have, correct?
It's close to that.
Okay.
It's shit. This shit. This thing's going to kill me, and I'm going to go out swinging. I mean, it wasn't I'm going to find a cure. It's I'm going to go out swinging on this guy with everything I got. And I'm probably not going to connect, but I'm going to go out swinging. And it was the realization, and the moment was that I had failed to respond to the only drug in development. So there's one drug, and the whole community over the last 60 years, the disease has been known and studied, one drug. They gave me that drug, and it didn't work. And so that was a frightening, terrifying, sobering moment, but that was moments after that when my doctor was like, look, this is it. We don't have anything else. Like, you just didn't respond to the only thing we got. There's no cavalry coming. There's nothing else coming down the road. And Caitlin, Gina, Lisa, and my dad were sitting in the room with me, and we just all were just bawling. I mean, just the full snot cry. I mean, everything, right? Because this is the world's expert saying there's nothing. And he said, we're going to try chemo, but it's going to stop working after a certain point. This is it. And that's when I turned to my dad, sisters, and Caitlin. And I said, I'm going to dedicate the rest of my life, however long that is, to trying to find a drug for this disease. And it wasn't that I'm going to find it, is I'm going to try to find it. And so what do you do if you got horrible disease and there's no research that's been done, and you don't have, basically it costs about $1 billion to develop a new drug from scratch, and it takes over 10 years if you want to create a new drug. Right. I didn't have $1 billion. I didn't have 10 years, okay? So, well, what do you do then? And so for me, it's like, shit, the only thing I could possibly do is see if there's an existing drug that's already approved for something else and see if maybe it could work for me, which maybe seems like the simplest idea, or maybe it seems like the craziest idea, but for me it was the only idea, right? It's like, if I want to survive, I got to find something, and the only thing I can find is the things that are on the shelf. Right. And so that became how I saved my own life, and now how I am just, as you know, I am on fire just trying to find as many drugs that are in the pharmacy we can use in new ways as possible.
So when you're starting to look, and again, I want to remind those that are listening, we're talking about, a degree from Georgetown, Oxford, Penn. We also have a degree from Wharton School of Business at Penn. So you're not the average Joe as far as academics and intelligence. A lot of people, I'm assuming, or I'm sure, they just don't have the mental resources to say, okay, that's a great idea, but how am I going to do that? You know, I mean, I don't know. I mean, most people wouldn't have any idea where to even begin. Yeah. And so for you, what were some of the first steps you said, okay, if I'm going to do this, if I'm going to go out swinging and I'm going to try my best to solve this equation, I got to solve this thing somehow. How did you do that? Because that's not an easy thing for the average Joe out there to say, hey, I can just go find a cure for my own, whatever. So how was that for you?
Yeah, it's a great question. I think that the steps that I took are repeatable and aren't necessarily just to find a cure for yourself, but it could be to do a lot of other things in life. And so number one is understand, what do we know about this thing? Again, whether it's Castleman's or it's some other problem you're facing, like, what do we know about it? What are the treatments that have been tried? What's known? So one's what's known. Two, how am I going to build the right team to take this thing on? And so that's connecting with all the physicians, the researchers, the patients that are already out there, connecting with them. And then it's three, with that team, with these smart people, I want to come up with the right plan to fight this thing. So understand the thing, build the team, and then with the team, come up with the plan to take this thing on. And so those three steps, again, I think are repeatable in other areas. But once we had the right team, we were informed about the disease, we had the right team, and we came up with our plan, we were really intentional about making sure that we understood, what was happening in patients like me in our blood that maybe we could target with the drug. And we came up with a long list of about 20 different studies that we wanted to do. And we had like no money at the time, but we were ambitious. It was like, look, we might not have any money to do research now, but like, we're going to raise money and we're going to march through these studies. And we actually have gotten through most of those 20 that we planned, from day one.
So at this time, you're, just to kind of keep it in context, you're still sick because we haven't found the cure yet.
Yeah, exactly.
You're in that place where you think the reality is there could be an end date here pretty soon.
For sure.
There could be an end date to this.
Yep.
Yet in that time, while you're in that period, you're beginning to formulate the plan.
Yep.
Was there ever a time when a doctor or somebody in this world that you're dealing with just kind of said, Dave, man, I know what you're doing, man, is really noble and it's wonderful and man, that's great, but
it's not going to happen.
Hey, man, I don't see it.
Yeah, I mean, that's actually the majority of the perspectives that I got. I'll give you one in particular. So one of the physicians who I work with really closely, he basically said exactly what you did, and I said, "What do you think the chances are that I'm going to find something out here?" And he said, "You want the honest answer?" I said, "Yeah." He said 1 in a million, and I started.
But that's one.
I started to smile because I'm a big fan of the movie Dumb and Dumber. I don't know how much you like Dumb and Dumber, but in Dumb and Dumber, when Lloyd Christmas is told that he's got a 1 in a million chance with Miss Swanson, he says, "So you're saying there's a chance?"
I got a
So
chance.
you're saying there's a chance, and that's what I said to this doctor. I said, "So you're saying there's a chance?" And he's like looking at me like
what?
What? And I'm like, "Well, it's 0 out of a million if I don't do anything. So like, I mean, let's take a 1 in a million shot. Let's take a swing at this thing." And again, I didn't think that we would necessarily find something, but I knew that we would definitely not find anything if we didn't try.
So now you're going to begin, and you're attempting, and you've put a team together, and you're at least launching. Okay,
Yep.
Now we're beginning. Let's figure out how to do this. At what point did you have a moment where something happened where you say, that's kind of a breakthrough? Like, okay, we haven't solved it yet, but we got a little wiggle room in here where maybe something good happened. Were there some of those along the way?
For sure. And unfortunately, some of those were followed with, oh gosh, we didn't actually find it. We thought we found something. So no, there were a few of those. And actually a couple times where we got an insight where we're like, I think this drug might be useful for my disease. And I actually talked to my doctor, and they actually put me on that drug, like very short period of time between the discovery and getting on it, and maybe some early sign that might be working, but then the disease would come roaring back, and I'm like back in the ICU, all my organs shutting down, and sort of like I failed myself. It's like, I gave it everything I had. I swung as hard as I could, and I didn't do it in time, and I'm not going to survive this one. And sort of the feeling of like, failure. I mean, all the stuff that I know you dealt with and your players when they lost big games, when they sort of put everything on the line, and it didn't turn out. And so that happened a few times, but then, about 3.5 years into this whole journey, when I had my last relapse, the thing that changed is that I started collecting my blood samples every week leading up to that relapse, because I knew that if I got sick, I wanted to be able to have the samples to do the research on in the lab. And that's when I had that first sort of like, I guess I'd had a couple failed attempts before, but now and really my third attempt was, I really think that targeting this one part of the immune system could actually really work for me. And yeah, then I talked to my doctor and he got me on this drug, and I had been so sick leading up to this, and within a couple of days of being on this drug, I started to feel better, and I didn't know whether it was the drug or like sort of placebo effect. But what I knew would be the real test is how long is it going to work for? Because the way Castleman's works is like when it comes for you full speed and it tries to kill you. And so it was like, okay, I may be feeling better now, but like, let's see if this prevents a relapse from occurring. And that's just a test of time. And so you just sort of like, every day is like one day longer, and you're sort of like, when's this thing going to drop?
But you're feeling better during this.
I'm feeling better. And
Okay.
I'm optimistic, but like, when's it going to drop? And the days have just kept coming by.
What would you say, and this will sound trivial, and I don't mean it to be, but what do because we all do it, and we've all had those points in life where things are good, things are bad. Isolation, you're lonely, you're desperate, you're down, you're moping, you're pouting because this didn't go my way. But I would imagine you find a way to overcome that. I mean, you've done all that. Like you've been there. Like you've been to the end, close. And then you've said, but I'm not giving up. I'm going to keep finding. I tried this one, it didn't work. I'm going to try that one, it didn't work. And boom, now I got a breakthrough, and maybe that one even didn't work. Yeah. So the average person out there, when we go through these, we all do it. It's human nature. The resiliency, I think, that you had, because I think a lot of people, Dave, just to be very honest, at some point they just say, you know what? Phone it in, man.
Yeah,
hey,
I'm going to enjoy my last few days.
It's good.
It's good.
And I'm going to go. Yeah. But, and not to sound trivial, because what you did is so much different, but you would say to those people, if somebody was sitting right across the table and they're like, Dave, I'm lost my job, lost my wife, lost everything, I'm in the dumps, and man, I'm ready to phone it all in. What would you say to them?
Yeah, I think that for me, the things that helped me get through those really low moments were looking to the future for what it was that if I were to get through this, I'm not saying I'm going to, but if I were to, what would that thing be that I would be chasing after? So, what is that thing that if I can get through this thing that I would go after? So that's one thing. You got to have a vision for the future. You got to have that thing you're chasing. Once that thing that you're chasing's gone, you're done. So one, the vision for the future. Two, you got to have the people by your side that you would do anything to be with. So thinking about Caitlin, I'm thinking about Gina and Lisa and my dad, thinking about my best friend Ben, physically by my side. Like I needed them like with me. I mean, basically like holding me up when I didn't have the strength myself. And then the third is that you got to take it, like it's a cliche, but you got to take it one day at a time, or maybe even 1 hour at a time. Right. Because there were points where I was at my lowest, and it was like, there's no way. If someone told me during a lot of these low points that, hey, David, it's actually going to get worse from this, and it's actually going to get worse for like months, I don't think I would have had the strength to fight through it. I mean, I just don't think I would have. But because I had this vision for the future, because I had my people at my side, and because I was really thinking about it hour to hour, like I can make it for the next hour. All right, I can make it for the next hour. That helped me get through it. And I think that, again, that is transferable regardless whether it's a disease or it's a low point because you're getting a divorce or you lost your job or whatever that low point might be. I think you need those three things.
I also, tell me if you would agree with this, because I think this kind of applies, or maybe it does, but I think for me it always has. And I've been involved in sports my whole life. I played basketball, coached basketball, coached at a high level, all those kind of things. But sports, they teach you so much. And it's not just how to throw a football or how to correctly shoot a foul shot. I mean, all that's great, the fundamentals of the game. But in those moments where, and for you, growing up, you're on the sidelines as a little kid watching NC State football a lot, NC State basketball, but you're there. Your dad's on the sidelines as a physician. But then you're playing even high school football and college football. those long summer days. I don't want to lift anymore. I don't want to run anymore. I don't want to do that one more sprint. I could really coast on this last one. I really don't want to give it my all. But something about sports teaches you, and I'm not saying that's everything for you, but did that play a role in kind of your resiliency and your? There's something about I'm gonna get up off the ground here, and I'm not giving in. I'm just not doing that. Do you think some of that for you?
100%. Okay. I think if I didn't grow up playing football, I don't think that I fight through those low points. I just don't. I think that in football and in many other sports, like they try to break you on the practice field. They try to break you during the game. Like you're literally constantly trying to be broken. But you're constantly trying to rise back up, get up off the dirt, keep fighting, and so and then you'll like this. So at Georgetown, our motto, my first 2 years, we would have E equals R on our shirt. Effort equals results. Well, we put in a lot of effort, and we didn't get very good results. Okay, so that equation was not right. It was like lots of effort, very little results. But it sort of it really helped me to understand like. You got to keep grinding, and you might not get what you want,
right?
But just keep grinding. Like, things might not be going so great. Keep grinding.
E equals R, but results for you actually translated to a different type of result.
You're right.
So it may not have been the result on the scoreboard.
You're right.
But it was results that you learned. When I was at UCLA many years ago, and I had the great honor of getting to know John Wooden, I always remember. And when I first heard him say this the first time, it was kind of like, whatever. Sounds kind of cool. Sounds great. Yep. But, he always used to say the mental is to the physical as 4 is to 1.
Okay.
And I would say that to my team all the time. Guys, the mental is to the physical as 4 is to 1. And so much of what we learn in sports, I learned it as a young guy growing up. I wanted to be a college basketball player, and I had these goals, and I wanted to be the #1 player in the state, and I wanted to be a Division I player, and I wanted to be drafted in the NBA and all those things. Was the mental part, the mental toughness that you have to get really good. Some guys are born with just amazing talent, and that's the exception. But the majority are people that you had to learn how to be mentally tougher. I'm going to beat my circumstances every day. I'm just going to beat it. I will win against my circumstances. My own mind is not going to beat me. I'm beating it. I'm going to do it. And so for you, I know there had to have been all those times as an athlete in the weight room, on the practice field, wherever you were, and as tired as you were, and I got to get up in the morning, and I got to do it again, and I don't want to, and my body hurts. But what you're really saying to yourself is my circumstances, they're just not going to beat me. And that had to just carry over.
It did.
Here you are now in the battle, truthfully,
for my life,
for your life. And the lessons you learned, probably, I'm assuming, really began to say, okay, here we go. I'm going to draw back because I'm not going to roll over. I'm not giving into this thing.
I agree. And so it's both the skills and I guess the experience of continuing to fight and grind even when the circumstances were tough. It also was a lot around teamwork, right? Because I mentioned earlier, the second thing of those 3 things I mentioned was around building the right team. And you learn a lot about team building from any sport. I think in particular football is one of these sports where, like in life, all of us have a very different role, right? We're not all taking the shot on goal, right? We're all doing a lot of different things. And so I think that there were a lot of things I learned on the field just in terms of how to be a leader, how to work with other people, that all of a sudden now I'm like, trying to march down the field to try to find a drug that's going to save my life. And I got to bring all those things into play that I learned on the field.
So many lessons. So switching gears a little bit, and I think this is why, they're beginning to work on a movie about your life here in Hollywood. Wendy Feinerman produced Forrest Gump. Small World, her father was our team orthopedic surgeon when I was at UCLA, and so I know her dad. It's amazing how small a world it is. But part of the story, which I think is attractive for Hollywood, but forget Hollywood right now, is kind of you explaining a little bit the love story between you and your wife. Because as I read the book, and then I've gotten to know Caitlin, who is now your wife, and her family, her parents, and gotten to know your 2 children who are young but just wonderful. But there was part of it where she's pursuing a little bit, and she's wanting it, but you're basically feeling like, look, I'm dying, and I really don't I'm not going to put you through this.
Yep.
And you kind of pushed her away a few times. Talk a little bit about that.
Yeah, absolutely. So you're going to get me in trouble with Caitlin when she listens to this podcast. It's going to bring back all these bad memories from Caitlin.
We love Caitlin. Yeah. So the end result is the true love story.
I'll tell you exactly what happened. I'll also tell you her perspective on things. So you're right. So we had dated for almost 3 years before I got sick. And then just a few months before I got sick, we decided to break up and take a break. And I was busy in medical school and she was finishing up undergrad. And then I got deathly ill. And so she wanted to come visit me. And I knew I was dying. I mean, I knew I was looking at my blood test. I knew this was it. And it was like, I didn't want her to see me right before I passed. I knew I didn't look like myself. I didn't feel like I couldn't really speak very clearly because I was so confused. And I just lost my mom shortly before that, and I had a lot of memories sort of burned in my mind of my mom when she was sick. And I was, a young 25-year-old. I think I mentioned this earlier. I just set the Virginia State bench pressing record. I was in such good shape, and all of a sudden, so I probably cared about, how I looked externally, and all of a sudden now I've got 70 pounds of fluid and I'm literally dying. And so I didn't want her to see me and remember me the way I looked. Now, I don't care, what I look like or what she thinks I look like. But at the time I did care about how I looked, and I cared about that being her final memory. And so I had my sisters tell her, you can't come up and see me. They stopped her in the hospital. Right. Gino actually was the one who went down and she's my enforcer. So and then,
I'm learning.
Yeah, that's right. And then the same thing happened at Duke when I was hospitalized a couple months later. Again, she came to Duke, and again, you can't see Dave. And so. And the third time it was, don't even fly out to Little Rock, which is where I was hospitalized at the time. And so, but Caitlin kept coming back. She's resilient too, and she kept coming back. And as I would bounce back from these things, and I think, well, maybe I could be okay. Like maybe I could have a future. I started getting excited about maybe it's a future with her. And so she came down to North Carolina, and we connected, and she didn't hold any sort of grudge. She wasn't upset about the getting pushed away, and we started dating again. And now at the time, and you've seen the pictures in the book, I'm bald from the chemotherapy. I got a belly that looks like I'm 9 months pregnant, and Caitlin's sitting there looking at me, being like, I want to start dating you again. And I'm like, are you sure? And she's like looking at me like offended that I'm like even asking her that. But we started dating again, and the second side of the story is that so I'm writing this book and having to dig back into some tough memories, right? My Saturdays I'm like crying in the room while I'm writing this thing, and I'm asking Caitlin, I'm like, tell me a little about this, and she's like, well, I thought that it was your sisters who didn't want me to come to the room. They sort of like they made it seem not that Dave doesn't want you to see him, it's that we don't think you should see him.
Took the bullet for you.
They took the bullet for me. So she was like always upset with them. Like, why won't they let me, come see him?
Right.
And I think to myself, like, I don't know what Caitlin would have done. Maybe if she knew the whole story, maybe this whole story is different, and maybe she's not sticking around the way that she did.
I have found to be really cool is that in getting to know Caitlin a little bit is that she just has such a pure heart, because we all know the reality. I mean, you can say it all the way different ways you want to say it. Most people, they wouldn't stick around.
They're running the other way.
They're gone. They're gone. This is not something I want to take on
totally
in my life.
And especially if he's the one pushing you away.
But, you have children, and, you have a life. And so the uncertainty of, how long does the drugs last? And,
yes.
So for her to, I can see why. Well, number one, they're just reality. She's amazing, and I've enjoyed getting to know her and her parents, and she's just a wonderful, wonderful person. But you can also see why, like even somebody like Wendy Fireman in Hollywood, there's an element to your story too that I'm sure Hollywood likes as well, the love story part of it. But it's real. It's not fake. It's not phony. She could have at any time just said, you know what? There's a lot of guys out there, and you know what? I know Dave's a great guy and all that, but I just don't know that I want to take that thing on. That's too much for me. She could have done that.
And I think that would have been the typical, normal, appropriate thing to do, right? I mean, it's sort of like the almost the sane thing to do. The insane thing, I think, is to say, I'm going to stay. I'm staying. I'm going to keep doing this thing.
And she was staying when you were still bald and fat and
Yeah.
this and that and fluid all over you and just
Yeah.
you're laying there in the bed. I mean, it's different if you're out walking around and
Totally.
you kind of he's on the road to recovery. So it's an amazing thing. So tell me a little bit too now about because I found it interesting, and you and I've talked about this. In 1995, I coached at UCLA. We win the national championship. In first weekend in April. In May, they take us to the White House, and Bill Clinton's the president, and we got our team there in UCLA, and we do the jersey ceremony that every team does, and then we go down the hall and we go into a room, and there's Bill Clinton, and I was always kind of a little bit like, I don't know about this guy, even though he's from Arkansas, he's kind of from the South, I kind of like him, but I don't really know about him. And within about 15 minutes, he had the room like.
Yeah.
It blew me away. Like, he was so genuine, authentic, and down to earth that our group, regardless of your political position, you just all of a sudden it's like, man, I like this dude. Like, I'm down for him. Man, what a guy. Like, and so you have a relationship now with Bill, Hillary, and Chelsea, and kind of tell me a little bit about how that came about, what happened, how does this get going, and then also a little bit about once you got to know them, then what's been happening with the Clinton Global Initiative, those type things. So tell me about how you first met him. How did it come about?
So I got to take you all the way back to to March 31st of 2021. So day before April Fool's Day, I get this phone call from an unmarked number. It says, "Hi David, I work for President Clinton and I got him on the other line. Can I pass him through to you?" And I'm sort of like, what? Like, it's the day before April Fool's Day, and it's like this unmarked number from some guy who's acting sort of really sketchy. And so I'm like, sure, put him through. Okay. So and then it's, David, this is Bill Clinton, and I'm like, I think it's him, but he's got such an exaggerated accent, right? It's a unique. No one talks like President Clinton, right? And so it takes me 15 minutes on the phone with him telling me stories and jumping right into things before I'm like, wow, this really is President Clinton. And so the reason he called is because he had read Chasing My Cure. He reads 50 books a year. And he read Chasing My Cure, and the story really resonated with him for a number of reasons. So one, we both went to Georgetown. We both went to Oxford for grad school. He loves college football. He was in the band.
Loves sports.
He loves
He's
sports.
A sports guy.
Well, he was in the band at Georgetown, so he watched every football game at Georgetown. And he was on the phone telling me about his favorite plays and this great nose guard for Colgate from and I'm like, what? So we bonded on that. We also bonded on our love for Little Rock, Arkansas. I spent a lot of time in the hospital in Little Rock, and my life was saved there a number of times. And then also. He invested a lot of time and effort and dollars, frankly, when he was a president, into health initiatives, into medical research, working towards cures. And he's on the call with me, and he's like, David, are you telling me that there are drugs that are in the pharmacy that could save more lives than they're currently being saved because no one is researching them? And I'm like, yeah, we haven't talked about this too much, but I'm alive because of a drug that wasn't made for my disease. I discovered that a drug made for kidney cancer and for organ transplantation, I thought it could work for Castleman's. That's that third drug that we mentioned earlier. And I tested it on myself, and it's now been over 9 years. I'm doing great on this drug. It wasn't made for me. I'm not really supposed to be here because this drug wasn't made for me, And so he was really blown away by that idea. And we spoke for about an hour that first time, and he said, David, what's your dream? What are you working towards? And I said, my dream is to do what I did for myself, but for millions of people around the world. And that's to find drugs that are already on the pharmacy shelf and to see if they could save their lives now, not 10 years from now or 50 years from now. And he said, well, I think you should do that. And when you do that, just know you'll have my full support. I want you to announce it from the Clinton Global Initiative when we relaunch it. I want you to know that I'll go out on the road with you and fundraise. I'll do whatever you need to do. And so I hung up from that phone call and did a lot of reflecting. And it was I hadn't really sort of even told anyone what my dream was, but he's sort of poking and prodding, and that's how I shared it. But once I shared it with him, it was sort of I think I need to do this. But it did take a while. It took almost a full year before I really, and actually he would call every couple of months. I actually met up with him in Orlando, and he pushed me again. He said, are you doing this? He says, I think you need to do it. Are you going to do it? And that sort of pushed me over the edge, and I haven't turned back since.
So we've talked a lot about, chasing your cure, the book Chasing My Cure, which you personally had with Castleman's, and you discovered the cure. But like you just mentioned, so we can talk a little bit more about that, so people will understand. So now, help me if I say this correctly.
Yeah.
It appears like your life mission now is to find those drugs. And I tell people all the time. I tell people about your story. We'll get to talking about it. And, I say, you go into a pharmacy and you walk down and you look over there and there's 1 million bottles of pills up on the wall. They're everywhere. You see it every time you go to the pharmacy.
Yep.
And there's one of those on the shelf that is made for one disease or one, whatever somebody needs, symptom.
Yep.
But that can also be effective for something completely different. So when I tell people about repurposing already existing drugs, it's almost like people go, oh, wow, like I never thought about that. Which a lot of people don't. They really don't.
Totally.
You don't think about it. And so now kind of that whole journey, because there's got to be a lot of possibilities that maybe no one's ever really dug into and researched.
That's exactly right. And so I'll share a couple examples that the listeners might immediately connect with. So one of them is a drug called thalidomide, which was made for leprosy initially, and then shortly thereafter was figured out to be effective for lymphoma. And I mean, if you can't think about two diseases that are more different than like leprosy, where your limbs are falling off because of some horrible infectious agent, versus lymphoma, cancer of your immune cells. But what shares an underlying basis is how this drug works. It hits this one part of the immune system that is important for both. And so the point being is that though two diseases may appear very different, the underlying problem may be the same. And so another example is Viagra. We all know the typical use for Viagra. It's actually also a life-saving drug for a children's lung disease. So there are kids who were dying by the time they were 10 or 11 years old before. Now they get low-dose Viagra and they live full lives. Oh, it's incredible. Wow. And so between my experience where I found this drug for myself and then these sort of experiences that happen very serendipitously, like there's never been a system to figure out what are the other uses for these drugs. It's just like sort of doctors try random things here and there. Some things stick, some things don't. And then through my center at Penn, so I got better. I joined the faculty at Penn and built this center. We've now done this 16 times, including the drug that saved my life, where we found a drug that could be useful in a different disease than the one that it was intended for. And we're only looking at inflammatory immune disorders. And so I'm sitting here, and of course, when I talk to President Clinton, it's like, that's just what we did for this small group of diseases. But like, what if we open the lens? And that's what we've done with this new nonprofit Everycure. So I ended up giving President Clinton a call and saying, I'm going to do this. I'm going to start this nonprofit. It's going to be focused on unlocking the full potential of approved drugs. So if it's in your CVS and it's approved for one disease, I'm going to figure out what the other diseases are that it could work for. And now the reason that this hasn't been done until now, and the thing that really fired up President Clinton and also fires me up, is that the reason this doesn't happen is that if you find a new use for an old off-patent drug, no one's making any money off of it. Because these 80% of all drugs that are approved by the FDA are off patent. And so like generic companies are making there's no money. And so I hear 80% of drugs are generic and I say, holy crap, that means that they're inexpensive, they're accessible all over the world. All we have to do is find a new disease for them and you can just save millions of lives for like no money. But our system says, yeah, but you're not going to make any money. And so let's go develop a new drug, one disease at a time. And so that's where it's like, we got to do this. The system's broken in this way where we, one drug, one disease, $1 billion, 1 decade. That's like, that's how our system works. And then, hey, then you make 10 billion on the other side. So like, that's how the system works. But what I'm saying is, how about we do one drug, 10 diseases, in 1 year, right? And sort of change the math and save a lot of lives.
We were in Trinidad. Your parents both grew up there, and we were sitting there. And we were actually talking about, this is when you were getting ready to launch the name, which is an amazing organization.
You get a lot of credit for this, by the way.
Everycure. I can't remember, but you had a different name.
Exponential Cures, and you said I was all in on exponential cures, and you told me no, and I get all the credit.
I'm not trying to down my degree from Alabama, but I remember saying I'm from Alabama, man. I don't know what that means. That's too big. That's too big a word for me. We got to dummy that down for us.
Yes.
But I love the name Everycure because there potentially is a cure for everything. We don't know yet. And so you did an amazing job with that. And I also remember when we were talking and we were sitting there in Trinidad and we were talking about it, and you know, I asked the question, I think, which a lot of people might ask, that says, these pharmaceutical companies, you know, they suck, you know, they should be doing this. And your answer was kind of like, well, you know, they're business, you know, and so kind of your thought on that, because I think a lot of people's first reaction would be that, like, what are pharmaceutical? Do they not want to do this too? Why aren't they doing this?
And exactly, I think it's a problem with our system. So I think that for every one of these drug companies, these pharmaceutical companies, I think that the fact that they got any one of these drugs developed and approved is amazing. I think we should be, because you can't repurpose drugs if you don't got drugs to repurpose, right? So first off, I actually am very thankful for what drug companies have done to develop 3,000 drugs for 3,000 diseases. So I'm very happy for that. And then I realize in the system that we're in, there's just no incentives for them to figure out new uses for their old drugs. Like they're actually going to spend more money on clinical trials than they're going to make off those drugs. And so, like, you don't need to have a business degree to know that, like, you shouldn't do things that are going to cost more than you're going to make back. At least in our system, you shouldn't.
Well, if I'm on a board of trustees at one of those the companies, I'm saying we don't really need to do that, because it's really not making us any money. Now, there's a moral part, but you know.
Yeah, you're right. I mean, these are for-profit companies. If you're on a board and you actually do something like that, you're actually going against your responsibility to your shareholders. You're doing something that's bad for their bottom line, which is actually, like, illegal. You can't do that. So I think in our system, I understand why companies aren't repurposing drugs. It's not because they're evil and they're like, we're going to hold off on this cure because, like, we don't want to pursue it. It's actually, it's going to cost us more to do the studies than we're going to make back in profit. And so, like, you know, someone else can find a treatment for that disease. Like, you know, no company has an obligation where they're like have to. You know, I think, again, there's a moral obligation here, but I don't have a problem, or I don't think that pharma is evil for not doing this. I just think that our system has made a mistake by not solving this sooner. Like, I think that, like, FDA, NIH, the federal government, some nonprofit somewhere, someone should have come by earlier than David Fajgenbaum with Everycure. I believe it should have happened sooner, but, you know, there's no better time than now, right?
And sometimes, not to get off track, but I look at our government sometimes, and we spend money sometimes. We cough up
Crazy
some
amounts.
billion here and a billion there, and we can find a billion. And I look at what you're doing, and I think even Bill Clinton mentioned that at the Clinton Global Initiative, like, you know, almost kind of a little bit like, why aren't we putting more money here? And you know, this is much more noble and important, and not the other things aren't. There are a lot of amazing things that our government that does for us, but you're kind of waiting to say, let's go right here. Let's get this done. I mean, this is it.
It's tangible. And the thing is, if you invest, let's say you invest $1 billion into, like, a future technology for drugs, you're going to see a return on that like 10, 20, 30, 40 years from now. You put a fraction of that into drugs that are on the pharmacy shelf. They're there. All you have to do is just make the connection, and then they're in people's bodies like in weeks. I mean, we've gotten drugs into patients within weeks of discoveries. And so it's about impact, but it's also about urgency of impact. And I can tell you, most people that are sick with diseases, we want solutions now. We don't want solutions a decade from now. So I mean, I totally agree with you. I think the good news is that I've seen a real shift within members of the U.S. government to being open to this idea. I mean, I think before there was sort of this concept with, like, yeah, you know, you might be able to do that for yourself, for your disease, for a small number of diseases, but, like, the technology doesn't really exist to do this, all diseases, all drugs. But with the advent of artificial intelligence and what we've all witnessed over the last few months, that AI can do miraculous things, that all of a sudden you can basically say, like, yeah, I could do it for one disease and one drug, but we can build an algorithm that basically thinks about the way I thought about one disease, one drug across all diseases, all drugs. And when we first ran the algorithm about 6 months ago, it was on track to take 100 days to run because it's such a complicated algorithm and so much data. We've refined it. The next time it was 8 days, and now we're down to 1 day. And that's just because the technology and the science advances so quickly. 100 days down to 1 day to run this thing. And so it's like, we are at this incredible moment in time where the system is sort of open to this idea that drugs could be repurposed. The technology is there to make this happen. And then you've got a team that I have the honor of being a part of that is like all in on this. And I think that when you have that sort of formula, I think we're going to make some major progress.
I don't think there's any doubt. So Dave, obviously I'm extremely proud of you. I think what you're doing is off the charts. It's you know, it's sometimes for me it's like indescribable. When I describe it to other people, I don't feel like I do it enough justice when I'm trying to explain exactly you know, what your real goals and motives and you know where your intent is, because I think it's as pure as anything there ever is, and I'm proud of you. And you know, one thing I always do you know, on our show, and I've enjoyed these podcasts. I love them because there's so much to learn from everybody. And I think with you, I think there's so much people can learn, and there's always something to pull from, you know, to learn. But you and I've asked you this question before, so you've got a little bit of a head start. But I've asked a lot of guys this. It's been interesting too because you know, the question always comes down to, like with your own children, you got two beautiful, wonderful young people that you know, just adore you and Caitlin and everybody around them. But and I have 5 children who are now a little bit old. They're grown, you know, they're young adults. But I always ask the question: if you could breathe and you could just gift, certain characteristics into your children, and you said, man, if I could just give you this, if you end up with this characteristic, I'll just be as happy as I can be as a dad. You know, as you become an adult one day, what would some of those be for you? What comes to your mind in that regard?
Yeah, it's such an important question, and I've just loved Mark over these last few years, getting to know you, and you're the quintessential coach, father, friend. I love it. You're a coach at heart, and it comes out in the way that you interact with all of us, whether we're your kids, whether you're players, or just future brother-in-law. So I love that about you. So for my kids, I think the 3 things come to mind. So number 1 is kindness. I think that I think that you got to give the world kindness, and I think I love that I see my kids have that in their heart. 2, I think you got to be honest, and I think that honesty takes you a really long way in this world. And then 3 is hardworking, and I think that the hardworking piece, obviously I learned a lot from the football field, but definitely learned that from this journey. These drugs, they didn't discover themselves, and this work with this new nonprofit, Everycure, right in the book. These things, they came about from just grinding, and so I think if my kids end up being kind, honest, and hardworking, I'll be happy.
Those are amazing characteristics, and it's interesting when I ask that question is because we all draw from all of our own experiences in life. You know, we all draw from that, and one thing I've learned with your family. Is those characteristics, especially the first 2, if from what I've learned, those would be words that everybody that knew your mother, that's what they would say about your mom.
You're right. And I think a lot of these things, I'm envisioning how I want my kids to be, thinking about, how I was raised, who raised me. Me and Gina and Lisa, we just, we think the world about our mom. I mean, she was that amazing. I mean, she really was. I wish you could have gotten a chance to meet her, but I will tell you, the more time you spend around G and Lise and me, I think you'll get a chance to know her through us.
Well, and in my trip down to Trinidad, and your mother was one of I think 5, and the other her 4 siblings, Charlie, Ian, Trish, and Jeannie. Laying around in the pool or sitting on the boat or talking, and as they all got to talk about your mother, those were all the things they talked about too. So it's real, and it's wonderful. So anyway, we could talk for hours. You and I talk all the time anyway, but man, I appreciate you being on the Front Row podcast as I get this thing going, and I'm having fun. But man, today is special, and I just want to say thank you for being on.
Thank you so much, Mark. This has been awesome.
All right, thank you.